All right, welcome back to another edition of We Rise Fighting Labor podcast. We bring you today's labor news, history, and analysis from the U.S. and around the world. This is a podcast to listen to with your fellow workers organizing on the shop floor. This is a podcast to listen to before walking into your union meetings. As always, I am Rico Rutia, here with my co-hosts Brian Pfeiffer and Jerry Scapaciulo. In today's episode, we present to you an interview with Connie Smith, president of the Wisconsin Federation of Nurses and Health Professionals, which is affiliated with the American Federation of Teachers Union. Connie will be sharing information about her union and the labor community's struggle to help keep healthcare services accessible. We're very excited to bring you this interview, and we will do so right after we check out this little beat I put together. This one is a little culture jamming piece I put together to protest the media's handling of the railway strike last year.
A work stoppage could cost the U.S. economy as much as $2 billion a day.
Costing the economy $2 billion a day.
Could cost the U.S. economy $2 billion per day.
Costing the economy $2 billion a day.
A strike will disrupt the supply chain again, cost $2 billion a day.
If a strike isn't diverted, it could cost our economy $2 billion a day. A railroad stoppage could cost the economy $2 billion a day.
$2 billion a day.
Okay, welcome listeners to this episode of We Rise Fighting Labor podcast. Today, January 15th, 2023 is Dr. Martin Luther King Jr.'s birthday. He and Mrs. Coretta Scott King were steadfast supporters of workers and unions, as we discussed in our previous episode of We Rise Fighting. Mrs. King, Reverend Ralph Abernathy, UAW members, and other labor and community leaders helped win important concessions for hospital workers in Charleston, South Carolina, organizing with Health and Hospital Workers Union, Local 1199 in 1968 and 69, and since then. Historian Stephen Calco from the Kiel Center at the Industrial Labor Relations School at Cornell University observed in 2021, while that campaign in Charleston, a city with a very hostile anti-union climate steeped in Jim Crow methods and ideologies such as right to work for less laws, did not lead to immediate union recognition. Conditions began to improve. Nonetheless, eventually, due to labor and community organizing, hospital administrators were either forced to recognize unions or improve conditions. Johns Hopkins School of Medicine was one of the first. Part of the Union Power, Soul Power campaign, Mrs. King in 1969 went on to rally crowds in Baltimore, Philadelphia, Pittsburgh, and 12 other cities for the essential rights of hospital and healthcare workers. And it's important to note that this was a year after her husband was assassinated, and she had 4 young children at home, and she went on this tour. Mrs. King and Dr. King always took a global view of workers, visiting many nations, such as Ghana and India. Dr. King once signed an ad in a major newspaper that declared opposition to the U.S. blockade in Cuba. And Mrs. King, along with Mr. Harry Belafonte and many other human rights leaders from people's battles in the 50s and 60s, was a steadfast leader in the anti-apartheid movement, supporting fighters in South Africa, and was also a strong supporter of LGBTQ and women's rights. Mrs. King described why hospital workers should unionize as they perform some of the hardest, most difficult work. She said, quote, "One thing that hospital workers, black, white, or brown, have in common all over the country is that they are poor, they are terribly exploited, and they need a union more than anybody else. That is why I'm with you, and you can count on me to stay with you in your fight for justice, for human rights, and for dignity," end quote. So today we are honored to carry on the legacy of healthcare workers fighting for dignity, respect, economic justice, labor and community solidarity. We have with us on this episode of We Rise Fighting, Connie Smith. She's the president of the Wisconsin Federation of Nurses and Health Professionals, which is a union that for decades has improved the lives of workers, patients, and the general community in Metro Milwaukee and other locations in Wisconsin. The WFNHP is affiliated with AFT Nurses, American Federation of Teachers, Nurses, and Health Professionals, the National Healthcare Division of the AFT. So Rick's going to kick us off introducing Sister Smith. Thanks, Rick.
Right on. Welcome to the show, Sister Smith. So if you could just start with some pretty basic stuff, who you are personally, what made you become a nurse, what got you involved in the union, maybe what, where your parents came from and just stuff like that, just basic stuff. Yeah, welcome to the show.
Thank you very much. My name is Connie Smith. I am the president of the Wisconsin Federation of Nurses and Health Professionals, and I'm not a nurse. I am a technical worker at the hospital. I worked in labor and delivery as a tech in labor and delivery for several years. I now work in surgery, and I maintain the desk, capture charges, schedule cases, and do a bunch of stuff down in surgery. As a technical person, I became the president because I've been an active member of WFNHP for 15 to 16 years. And when our president had to retire, I just moved into that position until a new election, which will happen later this fall. But I've been with these nurses and technical and service workers at St. Francis for 16 years. We know each other's struggle, no matter what it is in the labor movement, from those right here in the hospital to the UAW workers. When we first met back a couple weeks ago, I come from a labor family. My dad was Alice Chalmers' guy. So we see my dad on a strike line a couple times throughout my life. And I am the mom of 3 and the grandma of 4. And I have a dog.
All right, welcome. We're honored to have you on the show. And you mentioned Racine and the UAW 180 and 807 Solidarity Day rally. Why is a member of your union as a healthcare worker go down to Racine and support the industrial workers there in Racine? Is we just one of the things we like to do on the show is ask leaders of unions why they're participating in this type of solidarity. So,
sure. I think what's so important is that when there's an injury to one, there's an injury to all, right? So all workers need to stand with each other side by side to be sure that we take care of each other, because management won't take care of us. So if we don't stand with them and support them, when we may need something, they'll stand with us and support us too. So the reality just behind it is we have to take care of each other. And if we don't take care of each other, who's going to take care of us? That kind of goes into the whole philosophy of being a healthcare worker also. But just being sure that getting down there to make sure that those workers knew that my union, a healthcare union and a teaching union, stands with them while they're out there on that strike line. We also were down there. I was down there personally to be sure that, we were able to help support, we brought our donations or whatever for the gifts and stuff at that time, because it was during those, during the holidays when I was down there with him.
Okay, thank you, Connie. Yeah, every time we hear expressions of solidarity like that, it just fills us with wonderful feelings of hope about organized labor and what we can do in the period we live in. But I think at this point, I want to ask you, how did the COVID epidemic affect the nurses and healthcare workers as St. Francis, at its peak, and since then, what have the numbers of nurses that have left the profession? What's that been like, and what has it been like struggling to protect your gains with the administrators over there at St. Francis in recent years?
Right. Great. That's a wonderful question, because right now, Ascension's all over the news here in the greater Milwaukee area and probably across Wisconsin through the newspapers. And our loss of the workforce and what's going on at St. Francis currently, this isn't just COVID. This is not COVID, really. This is the fact that Ascension has started this back in 2017 when they took us over, and we've watched them slowly, not rehire, not just workers, but not just nurses and health professionals, but also doctors and things like that. Then when COVID hit and, we were already understaffed, it just became worse and worse. And they continued to do that same practice of not rehiring and not filling positions and slowly moving services from one place to another. And I think that's the only thing that did keep us together, as a group, was our union that, kept us strong, being able to make sure that we each were there for each other in the hospital.
That's fascinating because I think there's a common belief out there that COVID has driven many nurses out of the profession and that accounts for nursing shortages. But what you're saying seems to contradict that a little bit. And, begs the question, well, then, what is the problem? What is the problem here? And how much does the Ascension corporate majestic enterprise have to do with it?
Correct. And that is the problem, is Ascension themselves. Compensation isn't going the way that workers deserve. The raises aren't as appropriate, and or pay scales and offerings of wages aren't what they could and should be out there, especially at St. Francis, but even nationally and across the board in all these hospitals here in Wisconsin. Compensation isn't what it should be. And the only thing St. Francis does have for them that the others don't is our union that will be able to bargain over wages and hours and working conditions. That gives us a voice to be able to stand up for those workers and for our community. Because a lot of it is we really are sad for our community right now too, over our St. Francis community in the south side of Milwaukee, of the closing of a labor and delivery unit, just right before Christmas. And yes, it had to do with jobs, but also the loss of the service to the community is just ridiculous and unsafe and not what we would like to see for our community. And that's what we're here for. We're here to make sure to take care of the community, and we can't take care of that community because they've taken away services right now.
Just one more question. We are aware of this phenomenon of the so-called traveling nurses that in many major hospitals now comprise 10 to 20% of the nursing staff, and they are paid, I think they're paid well above union nurses are being paid, and they're housed in hotels. They're probably driven back and forth to the hospital. How does the hospital try to explain away, if they even try, that they can't afford to treat nurses better at St. Francis?
Well, they don't try to at all. They don't even try to explain it away. They pay what they could for the traveling nurses to use the excuse to get us through. But now Ascension has even started, when I speak to St. Francis, not even compensating traveling nurses anymore. So they are reducing what they're willing to pay. And so now we even have those leaving our bedside at St. Francis and some of the other Ascension facilities across the board. So they're not even, this is how a good way, a bad player in the game they really, really are, is they've they don't even want to staff us with traveling nurses any longer. So it's all of it. They are holding tight to keep their money, not give to the community for services over there at St. Francis, and not compensate staff to a point that our travelers have even started to leave.
All right. Hey, Sister Connie, now, actually, if we could backtrack just a little bit, if you could tell us a little bit about your union, who you represent, where, as in like what locations, and any message you may have for the membership right now.
Sure. We represent service and technical and nurses at St. Francis Hospital in Milwaukee. We represent lab workers at Frederick Hospital at Wisconsin Diagnostic Labs. We represent workers in Burlington at one of the Aurora Burlington hospitals. We represent people in Cumberland at Cumberland Care, which is a nursing home facility, and also the Cumberland Hospital. We represent nurses in technical workers there, and in Anago also, Wisconsin. Prior to Act 10, we used to represent a bunch of other public sector nurses who, with Act 10, a lot of their rights were taken away, and the ability even to maintain a union was really, really hard with what it now calls for, but the 51% of total body. So we still have somewhat of a chapter at the Milwaukee County Behavioral Health, but now it's starting to privatize, so that is dwindling. They aren't a certified, but we still have people there that participate in our union. And it's very there's a bunch of us out there, but there could be, to be honest, a lot more of us. Healthcare will be the big and up and coming people to organize and unionize, not just across our state, but across our nation. So I think what we want to have to our members and to anybody else listening is, if you know healthcare people that want to organize, this is the time. This is the place. It always has been, but it's really important now, especially where we're at with healthcare in this state we're in.
So, Connie, you mentioned that the Ascension committed a barbaric act against the laboring community by shutting down the labor and delivery units, which is absolutely outrageous in so many levels. Can you explain the campaign you're waging right now with your union, and what we and other supporters can do for that campaign, and maybe upcoming events that are happening? Thank you.
Oh, yeah. Yes, the week prior to December 23rd, so the 16th or 17th, that Friday in December, St. Francis administration told the workers in the labor and delivery unit that 1 week later they would be admitting their last patient on Wednesday, December 21st, and discharging and closing the unit on December 23rd, and that the workers there, the nurses and the technical people up on that unit, would have to then work until January 7th to receive their severance packages. And with that, they were supposed to go help the ER understand if people were just coming in that were pregnant and still need services, like help them figure out what they were supposed to do. The administration didn't even have anything together for that staff in the ED. And it was union nurses that put together all the information in a nice binder, hopefully to help any of those emergency room nurses at St. Francis, if they do have patients coming in. What is so egregious about it is, from our understanding, multiple people that were pregnant and planning to deliver at St. Francis were given no notice either. So we still had women coming into the ER thinking they were going to deliver there and have to be put in an ambulance and transferred out. So we went down to City Hall, and we had a rally down there one night. Last week, we were out in front of the CEO of Ascension Wisconsin's home down on the east side of Milwaukee. making sure that he knew how his decisions and the money that Ascension has, the billions that they have, they should be putting into that community over on the south side and for St. Francis Hospital and for those women and infants, and try to get some jobs back to the labor and delivery. So our campaign really is, we're trying to get Ascension to reopen services at St. Francis, which will consist of rebuilding a program, doctors, and that will get a program in there, and then we'll have nurses and the ability to establish something and for women to be able to deliver on the south side of Milwaukee. This Tuesday, so tomorrow, we will be having a coalition meeting at our union office, which is 9620 West Greenfield Avenue. And we're asking for community members and other organizations to come out and let's try to create a Safe St. Francis campaign. So we want to reopen our labor and delivery and establish a practice in there, but we also want to hold Ascension accountable to bringing back some of the other services that they've started to slowly take away from that hospital. Some of the cardiac care and some orthopedic care and things like that. So that's our next step is the coalition meeting tomorrow. And after that, we will see what happens in that coalition meeting and how we can get out there and hold Ascension accountable to our community and to our workers out here, all of them.
Thank you, Connie. And I just want to underscore and highlight something that you mentioned as far as a tactic, as far as showing up at the CEO's home. I just want to applaud you for that and thank you for sharing that on here. I think that the labor movement should be doing a lot more of that. It reminds me of a quote by the labor musician Utah Phillips, who says, "The earth isn't dying, it's being killed. And those who are killing it have names and addresses." So
exactly.
so
Yes.
yeah, kudos to you. Thank you for sharing that. Thank you for bringing that onto our show. And so that leads me to this question. That's very inspiring. What inspires you? What do you see in the labor movement out there right now? There's stuff happening with Amazon workers, railway workers, Starbucks workers, UPS worker. What do you see out there that inspires you? What gives you drive in all of this?
I think what's really inspiring right now is our younger workers, right? They are out there and they are pushing and standing up a lot stronger, and they have a bigger voice than they've had in the more recent past. So our younger workers are really strong out there. They know what they want and they know how to get it by voicing their concerns. And so that is really, really inspiring to me across the board. Now, let's be clear, I'm not very old, but I'm old enough to have grandchildren. But, it's great to see my son who's 21 and my daughter who's 30 and my daughter who's 32. They have voices like all these other young workers out there who are making sure that their voices are heard in the workplace. And what all they need to do now is, get those employers to listen. So it's great to see the Amazon workers, these young Amazon workers and these baristas, Starbucks and other ones here in the Milwaukee area that have organized different smaller facilities like that. And it's amazing to see their voice. But a lot of those young workers now, that is their beginning job. So they leave a legacy for younger workers there, but then they move into professions like healthcare and different other professions that are already organized or unionized, and they have that knowledge that they may not have had initially because they've started to build up unions in places that haven't had them in the past.
Yes. Wow. Connie, it seems like this is really uh, putting a spotlight on the activism of nurses and other healthcare workers in the U.S. This past year, many folks in those professions have gone on strike in California, Minnesota, and New York City, and even here in Massachusetts, we had a St. Francis Hospital, not part of Ascension, but part of Tenet Healthcare, that was on strike for 8 months, and that won their strike. But also, over there in Wisconsin, in Madison, nurses waged a campaign for union recognition and other demands, and similar actions are taking place not only nationwide, but specifically now in Great Britain, where in about a week or two, another 300,000 nurses are going to join 100,000 nurses currently on strike, um, for basically the same issues that you're facing, staff cuts and so forth. So, what do you make of this surge of activism among people in the healthcare professions?
I I love to see the surge in healthcare, right? St. Francis was probably one of the first in Wisconsin to healthcare to, or well, WFNHP or Candace, our legacy president, was the one that started healthcare unions here in Wisconsin, right? And it's great. We've known that we've needed to organize for a long time, and it's great to see it happening now. It's great to see the young people say, we're professionals and we deserve a union and a voice in our workplace. And we can do that and still care for patients. And we're not greedy, and nurses and healthcare people that are all about the money, because a lot of our campaigns are about safety and safe staffing and for our patients, with wages being other issues within these campaigns. But a lot of our campaigns now really have to do with staffing and ratios, not for the nurses as much, and it is, but so that we as healthcare workers and nurses can take care of these patients, and they can have and get and deserve every moment of care that they need. And it's not being lost because I have 10 patients. So we're fighting to be sure that people are getting the care that they need and the time that they need from their healthcare professionals, and not being spread all across the board and having somebody have to wait for a vital service, or even something as simple as being able to eat their lunch, to be honest, right? I mean, simple. It's simple. They may need help eating, and you haven't given them enough help with nursing assistants and other people that they're there to help a patient eat. And there's even more critical situations, but like just as simple as either eating or going to the bathroom. So it's amazing to see people wanting to be there and organize and unionize and have a voice in their workplace because of that. And we've gotten to that point where the corporatization of healthcare has created issues where patients deserve better. And that's what these fights are really for, making sure that patients get what they need too.
So, Connie, you mentioned that despite the laws that are really based in Jim Crow, like right to work for less, Act 10, much of this was modeled on Southern methods from Texas and North Carolina, historically coming out of a horrendous legacy of Jim Crow. Those two laws now exist in Wisconsin, among other attacks that have happened on labor. But despite that, we have many other guests on the show who from the South, Texas, North Carolina, other places, who are organizing in these environments despite these hurdles and these obstacles. Can you explain how some of that's being done in Wisconsin, despite some of these attacks? Many things are happening. Many different organizing campaigns are going on, and people are not just letting this roll over them. They're actually fighting back. including yourself and your union. Can you expand on that, please?
Right. Yeah, I think it's so important that we know now that people are understanding they're being held down, right? And they're not able to care for their families and have food on the table and a home over a roof over their head. And that having a voice in the workplace is what's giving them that. And for the longest time, it kind of was handed to them, and now we have corporations and administrations that have now come back around and are putting these pressures more and more and more and more on workers, and they have to stand up again. It kind of was like we stood up, and then we had this lull of, okay, it's good and easy, but now they're seeing that it's not good and easy anymore, and they're putting the pressure back on, and so workers have to stand up again, and they have to have a voice in their workplace, because if they don't, we're going to not be a workforce that is able to survive any longer on our wages and on our, and care for our children and put food on our tables and roofs over our heads, because they're calling us greedy, and they're saying that, teachers should be ashamed of themselves for wanting to make sure that they're safe in their schools, and how dare healthcare workers go on strike because they don't really care. And it's sad. And one of the campaigns years ago, when and I don't remember the CEO's name, but the one CEO of Aurora told nurses, well, if you want a pension, marry better, right? The brides campaign back in, I forget exactly what year it was before my time, but there was a huge brides campaign out of the Wisconsin Federation of Nurses and Health Professionals that, the CEO of Aurora, how dare, that's how you do better as women, and let alone don't even respect the fact that there's men in these caring professions too. So we have to do it.
Connie, in doing some research for the podcast, I noticed that Ascension has 19 hospitals in Wisconsin.
Yes.
And Rick over here has a specialty of corporate research, and it seems like you all have done some of your own significant research also in the incomes of the profits of the corporation, if not just the president there. But what have you got to say about this proliferation of huge healthcare conglomerates like HCA and Tenet and Ascension and Partners Healthcare here in Boston and Massachusetts? Do you think what do you think should be labor's strongest and toughest response to the growth of the opposition?
Well, what I think is what we need to be doing is looking into some of their real nonprofit status, right? They are sitting on these nonprofit statuses and holding on to millions of dollars, and not putting it back into the workforce, and not putting it back into anything in our, to be honest, here in Milwaukee or in this area, not back into our brown, our Latino community and our brown and Black communities. Ascension, a couple years back, tried to close down St. Joe's. Now it's targeting the south side of Milwaukee with the Latino community. And they have millions. Our CEO in Wisconsin last recognized payout was $2 million. Our CNO at St. Francis, $320,000. Our president of St. Francis, $600,000. But Ascension wasn't even willing to meet the standard of other facilities like Aurora and Freighter at an 18 minimum. They are still at a, and don't get me wrong, like we have people fighting for a 15 minimum, but that's still not even a living wage anymore. And we have a 15 minimum, but we have a for-profit food service and housekeeping at our hospital. That's minimum is higher than Ascension themselves minimum. Now, Ascension has their paws in that for-profit. They have something to do with those for-profit entities. If you do some research on Ascension, we talked about this back in 2017 when Ascension took us over, that they have for-profit wings. AFT nationally did some real big research when we found out they were going to become our employer. But put that money back into the community, put it back into St. Francis, put it back into your workforce, and do something instead of sitting there on millions and millions of dollars.
That reminds me of one of the sayings of a union organizer from the turn of the century, Big Bill Haywood of the Industrial Workers of the World, who said that every penny of profit is really just unpaid wages to workers. And
Exactly.
it's a stock example of it over there in your hospital.
Yes.
So, Connie, moving forward, you mentioned the campaign. We'll be having a meeting this week. And how can labor community supporters that are listening to the podcast and also those that they're in contact with help spread the word or help support your campaign there in Milwaukee at St. Francis?
First off, we're meeting tomorrow, Tuesday at 6 p.m. at our office, 9620 West Greenfield Avenue. So everybody's welcome to come, show up. We plan to get this coalition going to make sure that we can get services back to St. Francis, as well as other things within St. Francis, not just labor and delivery, but other services is our plan to build on. Anybody that wants to come, we're hoping we can get ideas from everybody. I've met some great guys recently that have been awesome at helping us with getting out signages and being there, with just support and help. So if you want any information on that, they can reach out to me at the office or on my cell phone. We can put that out there if you want, or they can just come up and we'll be putting it out on our webpage and whatever else we can as the coalition grows and we make plans to do things. We will let everybody know, and we would love anybody and everybody to come out and support this campaign to make sure that our community on the south side of Wisconsin, or south side of Milwaukee, has the services and a hospital they need in their community and not have to travel 20 or 30 minutes by car, let alone a lot of our immigrant people in our community don't even drive on the north side of town. They stay right there in their community.
So folks can also, you do a Facebook page, correct? So you can go there for videos or updates or any kind of things that folks could do.
Yep.
Okay.
They can see our website, the Wisconsin Federation of Nurses and Health Professionals. That it'll be all updated on there. We'll keep everybody up to date.
Okay.
And maybe one other thing we could do is once the podcast gets recorded, we could send you a link. You could post it on your Facebook page or send it out, and your members can listen to it at their leisure and get some support that way too.
Oh yeah, that would be wonderful. We have been putting everything up we can on our pages. We will make sure this gets on there too.
Okay, so Connie, we really appreciate your time this evening, and we will do everything in our power to get the word out about your campaign, share the information, and we send you and your fellow members and your community members that are supporting you, and of course the patients, and complete unity and solidarity. And we'll do everything we can here at We Rise Fighting to share the information about the campaign. And we wish you well and solidarity forever.
Yeah.
Thank you so much.
Thank you, Connie.
Bye.